Assalamu alaikum. Welcome back to Universal Physio. We are here again with another interesting topic. Before we start, I request you all to please like, comment, and share this video as much as you can, and also subscribe my channel. Thank you. So today's topic is bipartite patella. Bipartite patella. First of all, we have to go through some anatomy of a knee joint and patella. So, and how does it work? So, the knee is a meeting place, you can say, of two important bones in the leg: the femur, which is also known as a thigh bone, and the tibia, which is also known as a shin bone. The patella kneecap is a movable bone that sits in front of the knee. This unique bone is wrapped inside a tendon that connects the large muscles on the front of thigh and the quadricep muscles to the lower leg. So, what is bipartite patella? Bipartite patella is a congenital condition, which means it is present at birth, which occurs when the patella kneecap is made up of two bones instead of a single bone. Normally, the two bones would fuse together as the child grows, but in bipartite patella, they remain as two separate bones. About 1% of population has this condition, and boys are affected much as compared to girls. This condition is discovered in adulthood. When this condition is discovered in adulthood, so it may be because of incidental finding, which means that any health professional was investigating another problem around the knee, and he also discovered the bipartite patella. Yes. Now, what are the causes of this condition? Bones, most of the bones, including the patella, only have one primary ossification center. In some cases, however, a second ossification center is present. First of all, what is ossification? In development, the patella starts out at a piece of fibrous cartilage. It only turns into bone or ossifies as a part of growth process. Each bone has an ossification center. This is the first area of the structure to start changing into a bone. Yes. Normally, these two centers of a bones will fuse together during late childhood or early adolescence. If the bones do not ossify together, then the two pieces of a bone remain connected by a fibrous or a cartilaginous tissue. This connected tissue is called synchondrosis. Yes. Injury or direct trauma to the synchondrosis may cause a separation of this weak union between the two bones, which then leads to inflammation. Repetitive microtrauma can have the same effects. Cartilage has a limited ability to remain repaired itself. The increased mobility between the main bone and the second ossification center further weakens the synchondrosis, resulting in a painful symptoms. Now, what are the symptoms that a patient can feel? Most of the time, there are no symptoms. They are symptomless. Symptoms. There is a bony bump. When there is a bony bump or place where the bone sticks out more on one side than the other. If the inflammation of a fibrous tissue between the two bones occurs, then painful symptoms develop directly over the kneecap. The pain is usually described as a dull ache, and there may be a swelling felt. Movement of the knee can be painful, especially when bending the joint Atrophy of the quadriceps and misalignment of the patella can lead to the patellar tracking problem. Squatting, stair climbing, weight training, and strenuous activities with all they aggravate the knee, causing increased symptoms. For the runners, running downhill in particular causes increased pain, tenderness, and swelling. So now we will come to the diagnosis. Most of the time the condition is seen on the x-ray of the knee joint. Sometimes it is mistaken for a fracture of the patella, but since the problem usually affects the both knees, an x-ray of the other knee showing the same condition can confirm the diagnosis. If due to the proper mechanism of injury being present, the fracture is suspected. The MRI or bone scans are useful if the fracture doesn't show up on the X-ray. The presence of fibrocartilaginous material between the two bone or MRI helps the confirm diagnosis of bipartite patella. An MRI can also show the condition of articular cartilage at the patellar fragment interface. The lack of bone marrow edema helps rule out the bone fracture. CT scan will show the bipartite fragment but are not as helpful as MRI because the bone marrow or a soft tissue edema does not show up. So it is still not clear from CT findings whether the symptoms are from the fragment or a fracture. So now come to the treatment. Most of the time there is no need of any necessary treatment because people who have bipartite patella probably even don't know about it. However, if the injury occurs or painful symptoms develop, then the treatment may be needed. Non-surgical treatment, conservative cares involve rest, over-the-counter of NSAIDs such as brufen, and rehabilitation. If there has been separation of a achondrosis, then can be treated with immobilization for 4 to 6 weeks. The knee is placed in full extension using a cast knee immobilizer, or you can say dynamic patellar brace. Immobilizer is removable splint and usually only taken off to wash the legs and remain in place the rest of the time. Okay, then we have non-surgical rehabilitations. Physiotherapists may use the electrical modalities such as ultrasound or IFC interferential current to help ease of pain and decrease any swelling that may exist. Ice or heat over the knee can also help with these symptoms. The therapist may use the tape or a flexible brace to assist with symptoms. The aim of this treatment is to help guide the kneecap through its proper range of motion while you move the knee during your rehabilitation exercises or during everyday activity. Once your symptoms begin to subside, your physiotherapist will start you on some gentle stretching exercises in order to ensure you maintain your full knee range of motion. If you have been immobilized by the brace or cast, then your leg may be particularly stiff into the bending. Now surgery. If conservative treatment with immobilization is not successful in alleviating swelling or pain, then the surgery may be suggested. When the bipartite fragment is small, then the surgeon can simply remove the smaller fragment of the bone. But when the bipartite fragment is larger and also contain the part of a joint surface, the surgeon may decide to try and force the two fragments to heal together or fuse. The connective tissue between the two fragments is removed first, and the two bony fragments are then held together or stabilized with a metal screw or pin. This technique is called internal fixation. So here we are done with the all important information regarding bipartite patella. One thing I want to add is as a bonus is then another potential surgical treatment option is a procedure which is also called a lateral retinacular release. The vastus lateralis tendon exerts a constant lateral pull on the patella. In the patient with bipartite patella, this pull is usually on the bone of bipartite fragment of the upper outer patella. Simply cut the vastus lateralis attachment, reduce the constant pull on the bony fragments. Healing of the two bony fragments may occur as a result of decreased tension. So we are done with the bipartite patella. Hope you guys like it, and if you like it, please like, comment and share as much as you can. Thank you, and hope to see you again with another interesting topic. Khuda Hafiz.